COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drquadjo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Karamantang. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, yes! Welcome back. We have an episode that I'm really excited about because we've never had a naturopathic doctor in the mix. We've never really talked about integrative health, complementary medicine. So today is the day. We got, I'm going to say a now friend of mine, Dr. Dugald Seelys. Those that don't know, I'm a big fan of this family. Gene Seelys, radiologist at the Ottawa Hospital. Andrew Seelys, colleague of mine in the ICU, also a thoracic surgeon. You'll hear him soon on this show. Their father, John Seelys, rest in peace, who's probably the real reason I ended up being a palliative care doc. And Dugald, he really throws down on this episode. We talk about how complementary medicine could really impact people's chronic conditions, whether that's cardiovascular health, whether that's cancer, whether that's chronic pain. And we even talk a little bit about complementary medicine within COVID, some of the quote unquote taboo topics in some ways, but it's an eye opener. The reason I think it's important is because of the holistic approach, looking at the patient as a whole. What are elements within their care that could be optimized to give them the best outcomes? And we even make the case about how cost effective some of these strategies might be. Before jumping on that, I want to point you all towards solvinghealthcare.ca/shop. Our online conferences. We significantly reduced that price. We're talking $9.99 for Stress Manage It for low carb. So y'all hit that up, man. Knowledge being dropped all over the place. Sprinkling it. It's crazy. Anyway, jump on that. And without further ado, let's jump into our conversation with Dr. Dugald Seelys. Boom. All right, Quadcast Nation. I am absolutely excited to bring to you Dr. Dugald Seelys. We have so many ties to this family. I worked with your dad. I work with your brother, Andrew, in the ICU. See your sister in the hospital too, Jean. Seen her on the news too. So Dugald, welcome to the podcast.
Thank you so much. It's such a pleasure to be here and to speak to you. It's a real treat. Thank you.
Absolutely. I'm really excited to hear about your clinic because you're the first naturopathic doctor to be on the show. And I think there's a lot to be learned about alternative methods. And I think this would be a great avenue just to hear your thoughts on why you got into it. But maybe even specifically, Dugald, what's your clinic all about? Center for Health Innovation.
Yeah, great. Well, thanks for the opportunity to speak about this. I have been a naturopathic doctor since 2003 and graduating, and got involved in cancer research early on in my career at the college, at the Canadian College of Naturopathic Medicine. And so just in terms of moving to Ottawa and creating the clinic, there was actually, we started the Ottawa Integrative Cancer Centre in 2011, and it was really to be a sort of a flagship clinic looking at providing clinical care that is integrative, that includes naturopathic medicine, but other types of complementary and functional medicine for patients dealing with cancer. and to do the research in that. And that was really something that was done in conjunction with and supported by the Canadian College of Naturopathic Medicine from Toronto, where I graduated, and with a whole research arm. More recently, literally just a few months ago, we've actually expanded our care into the Centre for Health Innovation. So we're still the home for the Ottawa Integrative Cancer Centre, but now with the CHI, the goal is to expand our care to other chronic conditions that are really well suited for the delivery and the use of complementary and integrative medicine. So that could include cardiovascular disease, diabetes, mental health disorders, issues that are really can be supported by a more holistic approach to care. And so that's really sort of the main focus of the clinic is providing multidisciplinary integrative care to people with chronic disease that can benefit from it, and to do some of the research as well alongside this to evaluate the outcomes that we're seeing for the people that are coming to the clinic.
This is exciting. So maybe even give us a sense of like what kind of disciplines are within your clinic.
So naturopathic medicine is probably the core. We've got 5 naturopathic doctors here at the clinic. And then it would be, I would say, probably acupuncture, and then functional medicine would be the next. We've got an acupuncturist here who's superb and sees lots of patients, and he can see more at one time, whereas the naturopathic doctors are focused on one person at a time. And, we'll see people virtually, obviously now. We have a nurse practitioner that does a functional medicine kind of a practice that incorporates integrative elements of complementary medicine with more traditional, conventional medicine approaches. And then we've got yoga therapy, we've got craniosacral therapy, we've got psychotherapy, physiotherapy, massage therapy. I'm probably missing some, but it's a sort of a constellation of these complementary practices, specific area, and really focused on what are the key needs that the patient's bringing to the encounter.
Well, I get excited about this because I think we in medicine, we're pretty siloed. We're pretty, like, you got, specialists in the left toe, when it comes to orthopedics. Like, it's really been siloed. And I think the integrative models are what's lacking, approaching patients in a holistic fashion, because, it all ties. I mean, I don't need to be telling you this, but it all ties, like your mental health, your nutrition, your physical health, that all links together. And so, before maybe giving us a sense of, the impacts that you've had, I think some people get confused with the terms, like naturopath, alternative medicine, or alternative health. I heard you mention functional medicine too. Like, you get a sense of, like, can we get a sense from you, like, what's the difference between those specialties?
Yeah, no, it's such a good question, and so important, because people really have very, very strong conceptions about what these different types of practices can mean. And then, they're sort of blinded by that particular way of looking at it, I would say. But so I really do like to distinguish between alternative and integrative medicine and complementary. I think the reality of most alternative and complementary medicine, which is the umbrella term that's being used for this, is that people are using complementary practices, like with an acupuncturist or a massage therapist or a naturopath or a chiropractor, and they're doing this alongside the care that they receive through their GP, or if they've got something more serious that they're more dealing with acutely at the hospital. And they're doing this sort of in tandem, but in parallel, and not in collaboration. So integrative medicine is kind of the unicorn that we're trying to catch. Or that's kind of a strange way of putting it, but it's trying to. I'd say it's the goal that we're trying to achieve, where there's much more collaboration and less siloed, even between the complementary medicine and the traditional medicine. And as you described, there's lots of silos within each of those. So, but the more communication that can be happening between the practitioners, the much more supportive the patient feels and is, and there's less risk as well. And so that's the ultimate goal. the reality is it's more complementary. Alternative medicine is typically considered as something in opposition to or instead of conventional medicine with our hospital-based system. And some people are using that complementary medicine as a true alternative to care. But we try to really support people to make the choice that is more integrative, not alternative. And it obviously depends on, what the risk profile is for the patient, how, serious the condition, how much benefit they will receive from, say, surgery for their cancer, for example. We do not want to provide any alternative to that. We want to support them to make the best choice. And so often there's a discussion about what it is that the patient might choose to do. And that really looks at this alternative versus complementary and integrative piece. Functional medicine, you mentioned earlier as well. And that's it's kind of a way of describing much of complementary medicine in the sense that it's a physiological approach to supporting people to function better. Mm-hmm. And so it's not so based on diagnostic baskets necessarily, but it's the function of the body and the physiology as a whole. How do you support that? And that's how I understand functional medicine.
Mm-hmm. I really like the clear distinction between, complementary and alternative, because I think that, or at least for me, that really clarifies a lot, because I think most clinicians get most physicians get a little bit anxious when they hear some of these terms, because they're worried that instead of doing the conventional methods, they're going to do the alternative method, and, a lot of the times we're recommending something that is, evidence-based. It's going to be, likely going to benefit the patient. But I mean, my personal bias when it comes to complementary is that if we know it's not going to harm the patient, why not try? You know what I mean? Like, there's a lot we don't know, especially, I mean, we get pretty, I hate to put physicians in one kind of lens, but we often don't look outside of our box, if that makes sense. We don't look at the evidence for things outside of our specialties. So I think often there's a lot of benefits to some of these complementary practices that we just, as a physician, we do not appreciate. And so this might be a tough question, but can you think of examples in your practice of maybe some complementary initiatives that, you see a lot of benefit in, that are underappreciated, that can really benefit some of these chronic conditions?
Yeah. I think, looking at patients' symptoms and what they're dealing with that is most challenging at the time is sort of the sweet spot that I would find in terms of practice. So, someone who's coming in with chronic fatigue from, possibly lack of sleep, but also, from the debilitating effects of chemotherapy or radiation, then, that would be an area where I feel I have and can contribute to significantly in terms of improving that sense of well-being for them. And I see it all the time. And it's using a mix of different approaches, which could be, literally just changing the diet in a way that can be more supportive for them. And then certain targeted supplements that may help them in terms of their sleep and fatigue, dealing with, pain to some degree, although I often refer to the acupuncturist at the clinic for that, because I find them incredibly effective for that. But things like hot flashes, digestive complaints, these are some of the core areas which, the team of naturopathic doctors anyways have an ability to really have an effect on. And then for stress management, good, effective talk therapy, or just dealing with some of the uncertainty and the mystery of the medicine and what they are encountering is so powerful, because one of the, I think, benefits of complementary practice that we have is that we have typically more time. And I think that's part of the model in terms of, OHIP coverage and billing and all that is there. And unfortunately, patients, it is a fee-for-service practice typically for complementary medicine. So that is a reality that we're dealing with. But there is more time that patients have typically with the practitioner. And so it can explore some of the other areas that are contributing to their health, but it's not sort of the key top of mind focus and part of the pathology that they're dealing with. So I think that is a contributing factor to that holistic approach.
Mm-hmm.
But and you talked about before about, you know, physicians not looking at outside of that box. Well, I mean, physicians have so much information that they're trying to absorb and to keep on top of from in their own field. So it's, and for me, you know, like, I'm not going to advise a patient on what particular chemotherapy they should have or what surgery or like. So in some ways, the specialization or the silos can support the best information being provided to the patient. But ideally, there can be an openness to what else is out there that actually can be supportive for that patient.
Yeah. So, like, when should somebody see you? Do you know what I mean? Like, when should I was thinking about this before the interview. Like, should it be anybody with a chronic condition? Should it be after they've exhausted some things with their family doc? Should they be seeing you early? Do you know what I mean? So, from your perspective, when would you like to see or be involved?
Well, personally, I certainly like to see people early on in the process. If we're looking at, you know, cancer specifically, then ideally want to be part of part of their team right from the get-go, because then, you know, if they start dealing with a particular issue, you know, it could be a side effect associated with their chemotherapy or something like that, then we can try to be more proactive and get on top of that. But I think just in terms of the uncertainty of what people are facing, it's really nice to have a discussion of what is achievable through complementary medicine. And the reality is, unfortunately, in our social media and everything, is that people have very unrealistic expectations of what complementary and alternative medicine can provide. So that's a very important conversation to have too, because there's many cases where, you know, I'll deal with someone who is looking for that cure, the thing that they absolutely just need to do. And if they did do that, then they wouldn't, you know, they'd be able to overcome the disease. And I think that's generally, well, almost always a disempowering place to be, and just creates a lot of anxiety, a lot of negative energy for the patient. And so, being a bit of an information broker almost, and helping support decision making around what is, you know, achievable through complementary and naturopathic care is an important part. And so being early in the picture is helpful to get ahead of some of the symptoms that they may deal with, and then also to help them address some of the things and to make some of those lifestyle changes that can definitely be supportive for them, for sure. So, and other chronic conditions, I think the earlier is better. I think the naturopathic medicine approach and into complementary medicine approach should not be seen as something that to be used instead of. It really should be seen as something that can augment and provide support where physicians don't have the time necessarily or the expertise to give that feedback to the patient. You know, a GP may only have 15 or 20 minutes or half an hour with a patient if they're lucky. And so to cover some of that extra ground, it's just not possible necessarily. And I think that, you know, NDs, naturopathic doctors, are trained in referral, know when to send someone on for conventional care, know what the limits of their practice is at that point. And that's important. And I don't know, like, I think there's unfortunately a lot of disinformation about what naturopathic medicine is in the community, especially you see it on Twitter, and like, it's just rather unfortunate what we see in terms of the way that naturopathic medicine and alternative medicine is framed. And it's there's some bad actors, but there's bad actors in every profession. But anyways, sorry.
Well, that's great. This is what you're here for, because once again, we want to demystify, if that's a word, some of these concerns or some of the stuff that you might see on social media, because, you know, I personally think there's a lot of people that benefit from people like yourselves and clinics like yourselves that I've seen firsthand, whether mostly in the palliative care practice, in their journey with their cancer, I've been more exposed to. I was going to ask too, like when it comes to, because you guys have a lot of tools in your toolbox, especially being so integrative. I'm curious if you find that there's certain practices that give you the biggest bang for your buck, like in terms of, whether that's supplements, whether that's lifestyle, sleep modification. Because I always, this is my bias that comes in. I'm always all about looking at Pareto's principle, 80-20. What gives you the biggest, what gives you the biggest bang? And, I think this is something that often we don't think about enough in medicine. We sometimes inundate people with, hey, change your diet, exercise more, sleep, and all these kind of things. Whereas, maybe we should start with X, and this might actually give you the biggest benefit early on. Does any of the practices come to mind in your world?
It's interesting as just listening to you sort of reflect on it. Like I think, that 80-20 rule I think is applicable in so many different areas, and medicine and what is effective is probably very much the case as well. But I really look to the patient to give me the guidance often, because like if someone comes to see me, and I have it frequently enough, is like, I'm willing to do anything, doc, but just don't change my diet. I'm not willing to go there. And they may have a BMI of 35. They may be like, really suffering from that diet, and I will try to guide them to open that discussion at some point, but I'm not going to start there. And so there has to be the openness from the patient in terms of what it is that they might use, right? And what they're willing to do, because the approach the approach in naturopathic medicine certainly is very interactive with the patient. It requires a lot of the patient with lifestyle changes. So there's a coaching element that goes on, and so it's looking at the places where, yes, what are the key conditions that the patient's dealing with, what are the risk factors that they're dealing with, and addressing those, but really also going at it from what is the patient willing and wanting to do. And in some cases, supplements absolutely is the place that they want to start. That's what they expect, and they want to go there. And that's great. We've got a lot of great tools in that kit. But if they're more keen on doing this from an exercise, fitness, and dietary standpoint, well, that's even more profound, I'd say, because it can really give them the tools to live a longer and healthier life with what they have in the kitchen and what they have in the environment, all of that. And that's partly, and social as well. Like, it's like we look at the community that they have too. And how do you build on that? And COVID is decimating that too right now. But anyways, so that's not a great, like, it's not maybe as specific an answer as you're looking for. I think, like nutrition and fitness are core for everyone. So always go there. And that may seem like, well, anyone can do that and be a coach for it, but really to give good guidance and to motivate someone to make those changes, they need to be coached well. And I think that we can provide that support, and then targeting specific conditions that they're dealing with. And it just sometimes it takes that little nudge as a catalyst to get them into a different state of health. So, yeah.
No, that's fantastic. Because I don't mean to oversimplify it. I think that's why it's such a great answer, because what I'm hearing is it's really patient centric. It really is. You're going to their level, which is something I feel like we don't do enough. I really like the especially the concept, Dugald, of spending time with the patient, like really having that freedom of, or I don't know if it's freedom, but prioritization of we are going to sit down and really get to know you. And I've heard this from a few docs, because one of my colleagues, Tom Saris and Marlene Masul, they have a multi-morbidity clinic, which is also multidisciplinary. But I remember Tom saying, like, one of the key elements of creating success is the rapport you build because you spend the time. You actually listen and you actually are able to get achievable goals because you did listen, you have the rapport, and you know what tools would work better for them. And I think this is something that, can transcend not only naturopathic or complementary medicine, but it's a lesson for all of us, if you will.
Yeah, hearing the patient, as you described, like listening is such an important thing. And it's funny, like my initial appointments with patients is an hour and a half, and I often feel like that wasn't enough, you know. And then I'll have a follow up of an hour or 45 minutes. And I think your description of freedom is fair. It is a freedom to have that time, as long as the patients can afford it and have the coverage for it. It's not that expensive, but it's an investment that people are making. But it's one into their own health in that way. The listening, the active listening and hearing the patient's so critical. Yeah.
And typically, because you have a lot of tools in your toolbox in terms of, we mentioned reflexologists, massage therapists, etc. Is the typical patient, whether it's a cancer patient, cardiovascular, like how multidiscipline is this? Like, are you often seeing 3 different experts? Are you seeing 7 different experts? Like, to what extent are often the patients seeing other experts? Yeah,
it's like a good question, and it really depends on the patient, what they're like, what the scope of what they're dealing with in terms of their health issues. So, some people are dealing with a lot, as we know, right? Mm-hmm. Like, and so for me, I've got some training in counseling, but it's not my forte, and it's not where I can go to a certain point. I can hear, and there's a therapeutic encounter that's just happening from that listening component. But if someone's really dealing with, significant depression or mental health issues, then obviously I'm going to want to refer to one of the psychotherapists, or, ideally they have someone else in the community. Although we know mental health support in the community is rather stretched, to say the least. Mm. And so, it depends on what they're presenting with, and also what their affinity is. So someone who, for example, totally benefits from massage and loves that, well, then great. I'm going to be like, yeah, you should absolutely make massage part of your life. It's going to get you into a more relaxed state. It's going to help you, in other ways. And then for someone who's like totally has a fear of needles, I'm not going to refer them to the acupuncturist, even though that particular therapy might be absolutely the best thing for them, right? Yeah. So again, it goes back to patient preference, but so we'll get a range. Like typically patients might see 1 or 2, maybe 3 practitioners at the clinic, and some are even using 4, 5, 6. Like it's it depends on what they're dealing with and the experience that they get from those practitioners, and that sort of motivates the continuity of it or not, right?
Yeah, based on need.
Yeah,
and maybe Dugald, can you walk me through, like, without obviously, compromising confidentiality, but just kind of like success stories, like a typical, whether that's cancer patient, whether it's from a cardiovascular, what have you, but just given a sense of how well your clinic and expertise has impacted lives.
Yeah, the whole idea of the testimony that patients present with, and it's always anecdotal evidence, and anecdotes are evidence collectively, right? We know that, but it's not a controlled state. So I never have the scenario where I'm not treating my patients as N of ones, where I will flip them back and forth from a therapy to see how they respond. But the feedback that I'm getting and that I'm hearing from others is just, it can be transformative in terms of how they felt from, the week before to the week later, or, sometimes it's going to be longer. And stress reduction is big, and looking at like pain reduction of gastric pain and bloating could be something, reduction of things like, constipation. I mean, that's a relatively simple one in most cases, to help people with reflux can be totally, reduced. their sense of neuropathy and pain and sensation in feet and hands can be really, really improved. And so, you get, so we've got some really very, very good feedback from a quality of life standpoint. There's no convincing, I need no convincing of the impact of it. And we need to do more publications around this to get this, more recognized, I'd say, in the broader community, and then also to get this more integrated into medicine, I would say, through controlled trials. But it's the reflections from patients can be just transformative. Like it's and that's so rewarding because it just it's so validating for the work that we're doing, but it's really the work that the patient's doing in this too, right? They're making the changes that they need in their lives to help them become more transformed. And there's many scenarios where patients are on a trajectory that has a very poor prognosis, and they're not gonna survive the diagnosis, and that's just part of the picture. But it's like it's giving them some space to live better within that is also, I think, so important for them and for their family members. And this better than anyone in palliative care. My gosh, palliative care is so holistic in itself, right? You have to approach the patient from different ways. And it was interesting. My dad was he became a board member for the Naturopathic College in Toronto, when I was in Toronto, and his early reflections on naturopathic medicine was that there was a similarity in some ways with palliative care, which was very holistic. So he got it quickly in terms of what was interesting for me in this, anyways. But yeah,
absolutely. And I told you beforehand. The lessons your dad has brought to my world. An amazing palliative care doc. And then before I got to meet him, he was a nephrologist. Dean of medicine. I could pretty much guarantee I wouldn't be doing palliative care if it wasn't for your father, John Seelys. So I can't speak enough about how much I respected him and how much he's done for us. Yeah, I know you've had the opportunity to do a bit of research in your world and adding that complementary piece to some of the conventional medicine. What's your experience been with that, and what are you excited about these days?
Yeah, research is the I've been in research since graduating, and that was where I did more at the beginning, actually, and feeling just the need for more research into complementary and integrative medicine, because there are those misconceptions, and there is, we need more evidence for where things are the most effective, no question. So I'm very excited about research, and we've had the opportunity to do some clinical trials in conjunction with the Ottawa Hospital, and that's been wonderful. We completed a long study on melatonin, in fact, for non-small cell lung cancer, and that was with work with my brother Andrew Seelys, who's a thoracic surgeon, as you know. And so we actually just recently published that in one of the Lancet Oncology journals. So that was sort of helped build the infrastructure, but that was a placebo-controlled RCT, randomized controlled trial, very almost like a drug trial, but using a natural health product. And then from that, we had the infrastructure to look at a more pragmatic, holistic approach to care. And so we're now looking at the delivery of integrative medicine through naturopathic doctors at the Center for Health Innovation to patients that are also that have had surgery or about to have surgery at the hospital. And then we're going to be giving them a year's worth of care, essentially, to try to shift their long-term outcomes with the disease and to support quality of life. And we've got a whole battery of outcomes that we're looking at, and have been just blessed to be able to work with a group of physicians and scientists at the Ottawa Hospital that are making this possible. So that's really exciting right now.
That's super exciting because, I think we don't talk enough about like that latter project of, post-surgery, getting that having that complementary approach because, family doc, as you mentioned, family docs are busy. You're not going to see your surgeon for a lot of the issues that, that might come about. But to have that practitioner to support you, whether it's you can't sleep, whether it's pain concerns, whether it's your appetite, your diet, like all these things that matter are being actually addressed in a holistic, intensive manner. I mean, this is, to me, it's the future. Like if we're being serious about health, we have to be able to be more holistic in that way. So that what you're throwing down is actually really exciting, and I hope other places would be modeling something similar, because without knowing the ultimate result, it's not going to hurt. That's for sure.
Well, I really hope it is the future, and I think it is. And it's low tech, low cost medicine, actually. And it really is patient centered, and it's bringing them into the picture of their own care more effectively. And who's more invested in their health than the patient? No one. So if you can give them some tools to help support them in their health and educate them on them, it's going to make a difference for sure. And I don't think we own the monopoly on holistic medicine. The hospital is trying to be holistic. There's no question about that. And there are siloed pieces within the hospital, all that. But I think that the complementary medicine piece is a forgotten piece, and it's just left out of the picture. And it's hurting the patients, and it's hurting the system. We're looking at cost effectiveness in this study as well, and we're working with one of the scientists at the ORHRI, Kidnapa. Yeah.
We work with her tons. She's amazing.
She's amazing, and so we're looking at that effect. And we did a study that was published in the CMAJ in 2013 that was incorporating naturopathic medicine alongside conventional medicine, and we saw a cost savings of over $1,000 per participant in that study, and that was looking at cardiovascular disease risk reduction, and we saw a reduction in risk of over 3%. That was statistically significant, and we also saw a reduction in metabolic syndrome of, I think it was 14%, and that was that was in a randomized pragmatic trial that we did with Canada Post. And that was published in the CMAJ. And so like there is evidence for this, and we need to build on that. But this is low cost medicine, and it absolutely makes sense to incorporate. We're missing the whole boat on the environment, and the community is part of the picture and all that. But anyways, it's so I really hope, as you say, like this is more of the future of medicine, and we can keep developing our new technologies. Wonderful. That's great. But let's use some of these fundamental parts of how we support people.
Yo, like, you don't know this about me, but that's like my whole area of research is on how to reduce spending. And so that's why I've worked heavily with Kidnapa.
No kidding.
In the context of end-of-life care and ICU related, interventions. But you're like, I mean, you're speaking my language, especially like for me, what is slowly, like eventually just come to fruition is a lot of, you want to save healthcare dollars, it's all about prevention. Totally. You don't walk into an ICU, that admission could be like $20,000 to $50,000, one patient. You know what I mean?
Yeah.
1% of gross domestic product goes to taking care of critically ill patients. And so, that element of investing in prevention and however way you see fit, like jump on it. And then it's also, I hate to say this, but like, I didn't realize this about that 2013 study in the CMAJ, but like, why is that not being amplified? Why is that not being like, where's the knowledge translation with that bad boy? Like I mean, it doesn't sound, I mean, maybe it is a complicated intervention. I don't know, but without reading the paper, but it sounds not that complicated. And you're improving outcomes and saving dollars. Boom.
Yeah, I think so. And I mean, it's a much bigger discussion, obviously, but in terms of, how the whole socioeconomic structure of medicine is geared. And I'm an advocate for the right use of the right prescription medications and pharmaceuticals at times, no question. They can be life-changing and life-saving, but our reliance on pharmaceuticals and is just, it distorts medicine. And I think that, so that's part of the picture. And I don't know, it feels like there is just almost like an orchestrated approach to try to suppress what can be more empowering to the patients and more effective. And complementary medicine just gets short shrift and shortchanged and denigrated in like Twitter. Like I said, there's serious public figures that have made a career out of sort of debunking, as they call it, complementary medicine. And there's some stuff that needs to be debunked, I guess, for sure. I've been involved in some of that research as well. But to take the whole thing and say it's all, it has no value. It's ridiculous, and it's doing a disservice to public health.
I started to jump in there, but one of the biggest, because I mean, we'd be doing a disservice if we don't bring up COVID. There's two things that come up to mind when it comes to holistic or complementary medicine that I think has been interesting. So we're how many months into this pandemic? Years, over a year. And what has been absolutely clear to me has been the concerns about metabolic health and COVID outcomes. Right. It's like you're right now. I apologize. I'm getting news requests to talk about in the news about younger patients getting sick from COVID. Yeah. And one of the things that you're not going to hear in the news is that the ones that we're seeing in their 50s, late 40s, they still have poor metabolic health. They still are diabetic and obese.
Yeah, these are risk factors, right, for worse outcomes. So we should be approaching that group absolutely proactively to get them into a better state of health. Absolutely,
100%. Yeah, and I'm just thinking, what was it? Say like May 2020, when COVID cases were going down, we're going into the summer months, and it was quite apparent that things was settling before this second wave. What an opportunity to be able to promote healthy living.
Totally.
And so that was one thing that I would love to hear your input on. And the second is I've never, in the medical community, I think this is, I still don't understand this. So there's links to low vitamin D to poor outcomes for sure, right?
Yes.
Whether it's the chicken or the egg, like you're metabolically unhealthy, so you have low vitamin D, or because you have low vitamin D levels, you're prone to COVID. For me, the data is not clear. But supplementing somebody with vitamin D is like as close to benign as you could get. You know what I mean? Like, it's going to be exceptions. You got kidney stones or something, like maybe. But like for the general public, there's almost little downside. But you bring this up to infectious disease docs or anybody tied to COVID, they'll be like, there's no evidence for this. There's no evidence. But what? Maybe there is. So, are we studying this to any great extent? Anyway, well, sorry, I don't mean to.
No, it's. I'm so glad you asked the question, because we are submitting to Health Canada literally in the week a clinical trial for the application of a micronutrient. Micronutrients at high doses, including vitamin D, zinc, K, and vitamin C. Mm-hmm. For COVID control in the community, to reduce the severity and duration of symptoms that people are dealing with. So and it's going to be placebo controlled. We are doing this RCT. Mm-hmm. I'm working with Dr. Kuman and Wilson, who is the co-PI on the study. Yeah, and know him well. So we're getting this into the Health Canada. We're going to be running this trial in partnership with the Ottawa Hospital. Vitamin D has definite data to support it being used, and many people are deficient. And that's not as far as preventative medicine. We should be looking at people's vitamin D status. I don't know if annually, but at least every couple of years, And that one is being delisted from one of the tests that are covered by OHIP, which is just, I don't understand that at all. I run it all the time with my patients because, and they pay their $30 or $40 or whatever for it. And it's useful because then you get a sense of where their status is. And from a cancer perspective, it has a role. And for a COVID perspective, it seems to have a role. And as you say, even if there was no benefit, the risk of its application is virtually nil.
100%. But like it's almost taboo to bring it up. This is the thing, like, which is, to me, this is the part for me that really irks me. And I'm not, I don't know. I think I went to medical school. I saw the same data and approaches to problems as everybody else. But there's this mentality. It's got to be placebo, randomized controlled trial. Like there's still a place in medicine for therapies that we think are beneficial that's not showing harm, no signal towards harm. Yeah. And the other thing, Dugald, that gets me a little bit perturbed is when we do these studies, we do them generalized. We don't really try and personalize it a bit. Like, you know what I mean? Like, so if there's 10 COVID patients, maybe there's one or two that have a specific, unique characteristic that really tells us or gives us a signal that they would benefit from vitamin D or any of the micronutrients that we just talked about. But we don't try and look at that. And I don't know. And it just kind of baffles me within the scientific medical community. Why aren't we being more analytical in that sense?
Well, the RCT is designed more for the benefit of the particular intervention than for the person necessarily. And so I think there's pragmatic research that you can look at that is more individualized, that is good. But our model of research, not that, and I love the RCT model because it's a very, from a scientific standpoint, you can really get clear answers of causation, but it has it's lacking a lot in terms of the real way that medicine is applied. And as you're pointing out, the individualization of the person. And it really is geared to support the marketing of a particular drug. Like I've become quite cynical about that, but I think that's the reality of it, more than actually providing the benefit to the patient.
Yeah, more years of getting involved in research, you do start to wonder, you start to question some of these things. Anyways, I just think there needs to be a little bit more open-mindedness in our world right now and less, I don't know if it's political or I don't know if it's siloed. I don't know if it's just black and white thinking. We just need to be more open-minded, explore, there could be answers there that we're just not entertaining because of, not thinking widely enough. Because you were so passionate about talking about vitamin D, I'm wondering if we could do some like quick hitters, if maybe they're not quick hitters, but other kind of underappreciated tools for your choice: sleep, mood, weight loss, cardiovascular health. Because once again, I don't get to talk to a naturopath that often, and sometimes there's these elements that there's these supplements I've never really seen in clinical practice. I'll give you a quick example. Like one of our producers on the show can't stop talking about L-naltrexone.
Oh, low-dose naltrexone? Yeah.
Yeah, low-dose naltrexone as an anti-inflammatory and all these things. You're not seeing this in the conventional media, for example, or in medicine. And I mean, I don't know the data, but this is what I'm seeing if there's any of some of these medicines or treatments that come to mind with some of the common practices that are common conditions that you see.
Yeah. Interesting. Low-dose naltrexone. I know that our nurse practitioner will use that. So it's off-label. So it is a prescription med, but for conditions like chronic fatigue, and actually has, seen significant improvement in that. And there's a variety of I'd say supplements that I find can be helpful. Things like magnesium and vitamin D and even vitamin C to some degree, can facilitate change for the patient. Magnesium I use frequently. Melatonin, not in all cases, and there are scenarios where there would be, either contraindications or adverse events that could occur. But by and large, it can be quite supportive for people for sleep, and there's other roles for it as well. There is, mushroom extracts for the management and support of immune function to some degree as well. Mm-hmm. And then, there is alpha lipoic acid. I mean, there's a whole constellation of these that are available that that have a role and have some evidence for application, but it's not a slam dunk in terms of you're going to say like every person with this case is going to be dealing with this. So that's where I think we do need more evidence on specific agents to say this is really effective for this condition. But but looking at it more from a functional standpoint, and you see how people respond, then that's some evidence for them individually. And then we can do some testing in terms of inflammation or, vitamin D status to see where they're at to and gauge it there. There's blood sugar management that you can do through, to some degree, supplementation and obviously diet. Yeah. So it's out
of curiosity, two though that I'm curious. So can times where you think about using magnesium, and then also some complementary medicines that you're thinking about for blood sugar management? I'm just curious.
So there is the evidence is spotty on this, but cinnamon, alpha lipoic acid, berberine have roles to play in terms of blood sugar management. For someone who's got serious diabetes and their blood sugar and their HbA1c are quite over 6. I would rather them to be on metformin. Like that's where I would be more comfortable with. But if someone's, I don't even know if I like the term pre-diabetic, but someone who's got more likelihood to develop diabetes down the road, I'm going to be looking at, diet and exercise as fundamental. And then maybe some of these supplements to try to bring the blood sugars down a little bit. Magnesium can be incredibly supportive for people who have restless leg syndrome or are dealing with constipation or headaches or muscle pains. Like I can see some major changes in people with that very quickly. And talk about a low risk supplement. I mean, the worst scenario you're going to get is you take too much, you get diarrhea, right? I mean, that's, it's sort of a self-limiting kind of a thing. But it's I think where it becomes more risky is where someone's going to use that particular agent instead of something that is really necessary for them in a more serious condition. But from the prevention standpoint and the supportive standpoint, these can definitely have a role.
Dugald, this has been a slice. This has been a lot of fun. I've learned a ton. It's a bit inspiring, not only in terms of, promoting complementary medicine, but just adding that integrative approach. I know right after I'm getting off with you, I'm looking up that CMAG 2013 study, because like I said, that's right up my alley. And it's what we're all about, trying to, improve outcomes and reduce spending. And I'm just, like I said before, I'm a little disappointed that it hasn't been like amplified tons, but hopefully this won't hurt. Yeah. But I really appreciate you coming on, and thanks so much for joining us on the show.
Thank you very, very much. Really, it's been a total pleasure for me and really great to connect.
Qualcast Nation, tell me knowledge wasn't being dropped all over the place with Dugald Seelys. Thanks so much for doing that, my friend. Follow us on YouTube, Instagram, Twitter at Qualcast. Leave any comments at qualcast99@gmail.com. Please leave that 5-star rating. We love you. It makes a difference. It helps with the visibility. Go to iTunes or Spotify to throw down. And guys, thanks for your commitment. Thanks for the love. We feel it. Stay safe. Peace.